look at this spotter of an image. A child presents with this finding on a skull X-ray. All of the following could be the differential diagnosis in this case, except. So what we see in this X-ray is basically a widening of the diploic space, and multiple trabeculae then appear as the spiked appearance. So this is called as a crew cut appearance or hair on end appearance, very typically seen in hemolytic anemias like thalassemia, sickle cell disease, ferrocytosis. This will not be seen in aplastic anemia because the marrow space will not be widened in aplastic anemia, right? So widening of diploic space will not be seen. We'll discuss this as we go ahead. A very peculiar condition, affecting the bones in childhood. So 10-year-old child presented with limb pain, normal bone mineralization is a clue, right? Vitamin deficiencies can affect bones. One particular vitamin deficiency occurs, bone mineralization is hampered. The other vitamin deficiency like this, bone mineralization is maintained. So this is a clue. The radiograph shows a white line of Frankel at the metaphysis, shows a white rim around the epiphysis. So this Wimberger epiphysis, white line of Frankel is all suggestive of scurvy. We will discuss this in detail as we go ahead. Let us start our discussion by discussing rickets, and we are going to discuss an imaging and its pathophysiology correlation. So rickets, as we all know, is basically a deficiency of vitamin D. The most common age group in which rickets usually presents is around 6 to 12 months of age. 6 to 12 months of age is the most common age group which is affected. Now what happens in vitamin D deficiency? Vitamin D is required for what? Now if you look at the bony structure, if this is the metaphysis, this is the fascial plate, and this is the epiphysis. So this is diaphysis, this is metaphysis, this is epiphysis, and this is the fascial plate of cartilage. The most important role that vitamin D actually plays is that it causes calcification at this metaphyseal margin. So the cartilage of the fascial plate here, this is calcified, gets incorporated into the bone, and that is how the bone actually increases in length. That is how growth occurs. Now when vitamin D is not available, what is going to happen is that this calcification of the metaphyseal margin will not occur, and so the metaphyseal margin or edge becomes extremely ill-defined or blurred. This is what is called as the fraying of metaphysis. So look at this image here. In this image, if you look at this margin of the metaphysis has become extremely blurred or indistinct. This is what is called as fraying. Now the fascial plate of cartilage, because this cartilage is not getting converted, right, is not incorporated into the metaphysis, it's not getting calcified, the fascial plate of cartilage enlarges. So this fascial plate of cartilage here, right, is relatively wider now as compared to what it normally should have been. Now because this calcification is not occurring at the metaphyseal margin, this calcification gives the metaphyseal margin its structural strength. So if the calcification is not occurring, the metaphysis becomes, structurally weak. This structurally weak metaphysis, when it is, subjected to stress related to movements, related to weight of the body, what is going to happen? This metaphysis is going to widen, it is going to get cupped. That is called widening and cupping. So if you look at the shape of the metaphysis, it has widened, it is relatively cupped like this. So that is how in rickets we get fraying, that is the indistinct margin of the metaphysis. We get widening of the fascial plate of the cartilage because the cartilage becomes excessively deposited there, and there is widening and cupping of the metaphysis. That is because the metaphysis has become weak because calcification is not occurring. So this is widening, cupping, fraying, and widening of the fascial plate of cartilage. So these are skeletal signs seen in rickets. Now there's another finding which is seen in rickets, and that is called rickety rosary. What is rickety rosary? In pediatrics, you must have seen a clinical photograph where we see these round beads at the costochondral junctions. On a radiograph, if you watch very carefully, see if this is a rib, this is the anterior edge of a rib or anterior end of a rib, you can see that there is expansion of the anterior ends of ribs. Right? In a child, expanded anterior ends of ribs, right, like this, most common cause is rickets. This is what is called as rickety rosary. This happens because of the hypertrophied cartilage. This occurs because of the hypertrophied cartilage located at the costochondral junctions, costochondral junction. So hypertrophied cartilage at the costochondral junctions. Now sometimes in rickets, pigeon chest or pectus carinatum can also be seen. Harrison's sulcus happens, that is the diaphragmatic insertion site. There is a sulcus which is created. So pigeon chest or pectus carinatum is also a feature of rickets. Harrison's sulcus, a sulcus which is seen at the diaphragmatic insertion site, is also a feature of rickets. Now, how do we assess healing rickets? Now, we've seen this particular child. This was a child diagnosed with rickets. We saw widening, cupping and fraying of the metaphyseal margin. But when you treat this child, how do you treat this child? There are specific regimens. You'll study this in pediatrics. High doses of vitamin D are administered. Right now, how do we monitor whether the child is responding to treatment or not? Do you remember I told you the role of the role of vitamin D? I told you that if this is the metaphyseal margin, what is the role of vitamin D? The role of vitamin D is going to be the calcification of this metaphyseal margin here. So as soon as you give a therapeutic dose of vitamin D becomes available. What will happen? The calcification of this metaphyseal margin will start, and that is a sign of healing rickets. So if you see in this particular image here, see this white line that you see here at the metaphyseal margin, this tells you that the child is responding to treatment, and therefore this is a case of healing rickets. So this is a case of healing rickets. That is how the radiographic sign of healing rickets is. Now, vitamin D deficiency affecting adults or adult rickets is called osteomalacia. Again, it will give rise to delayed or decreased mineralization, lack of osteoid mineralization that will occur. Weak bones will happen, diffuse osteopenia will happen, and there is a very peculiar feature which is seen especially involving the femur, right, where you see transverse lucencies involving the cortex. So these are given a name. These are called as pseudo fractures or loser zones. If you see in this particular image here, see, can you see the horizontal transverse bands there? So most common site of involvement of these loser zones or pseudo fractures because of weakening of the bone is usually the femur. They are commonly seen involving the neck of the femur, but here they are seen involving the femoral shafts, right? So there is diffuse osteopenia, right? Bone mineralization is decreased or abnormal. There are transverse defects involving the cortex. These are called as loser zones or pseudo fractures. Now, along with this, what is seen in osteomalacia is typical appearance of the pelvis, which is called as a triradiate pelvis. Triradiate pelvis, because the bone have become soft, bone has become weak. There is the acetabuli protrude into the pelvic cavity, so that is called as protrusio acetabuli. Protrusio acetabuli, triradiate pelvis. Bell-shaped thoracic cage is also seen. Bell-shaped thoracic cage. So these are all features of adult rickets or osteomalacia. Now we come to scurvy. Now scurvy is due to deficiency of what? It is due to deficiency of vitamin C, right? So it usually affects the age group around 8 to 14 months. Now it particularly involves children in the age group of around 8 to 14 months, when these children are fed with boiled milk or pasteurized milk instead of breast milk during the process of feeding. So boiled milk or pasteurized milk they are fed. This typically leads to vitamin C deficiency resulting in scurvy. Now we will come to the pathophysiology of scurvy in short. Let us quickly focus on the imaging findings here. So what we see basically here is that the central portion of the epiphysis becomes lucent and there is a sclerotic white rim around it. This epiphysis is given a name. This is called as the Wimberger epiphysis. This is called Wimberger epiphysis. Then you see a white line right at the metaphyseal edge here. This is called as the white line of Frankel. White line of Frankel. Just proximal to it, there is sometimes a dark band which is seen, as is seen here. So this particular dark band just proximal to the metaphysis is called as the Trummerfield's zone of rarefaction, Trummerfield's zone of rarefaction. And the metaphysis occasionally has a very sharp spur like this. So these spurs, see, so these spurs are called Pelton spurs. So Wimberger epiphysis, white line of Frankel, Trummerfield zone of rarefaction, Pelton spurs. These are all features of scurvy. Subperiosteal hematomas are also known to occur in scurvy. So this will give rise to the pseudo-paralysis or frog-leg appearance. The child is very afraid to move the limbs because it is extremely painful. Remember, clinically, pain is a feature of scurvy, which is something which is not seen in rickets. Now, why in scurvy do we get these findings? There is a biochemistry connection here. Vitamin C deficiency, that is scurvy. Vitamin C is required for what? Vitamin C is required for cross-linking of collagen fibrils. More specifically, it is needed for hydroxylation of proline and lysine residues of collagen. And because collagen is weak, because this cross-linking does not occur, right? Collagen is a very common component of the musculoskeletal system, and therefore all these MSK imaging findings are seen in scurvy. So that is what is the biochemistry connection of scurvy in vitamin C deficiency. What happens? Yes. Now we come to another peculiar condition, and that is hyperparathyroidism. Before we go to hyperparathyroidism, let us discuss a little bit of physiology. So what is the function of parathormone? So parathormone, what is the normal function? The normal function of parathormone is to increase the serum calcium levels. But how? By causing, most importantly, most common mechanism of action is most commonly by causing bone resorption. Right? So now see what happens. If there is a tumor that secretes excess parathormone, so if there is excess parathormone coming from a tumor or an adenoma, what will happen? It will give rise to excess bone resorption, isn't it? And all the imaging findings in hyperparathyroidism result from what? They result from this excess amount of bone resorption that occurs. Right? Now, this parathyroid tumor is called as a parathyroid adenoma, right? And a parathyroid adenoma is going to secrete excess parathormone, which is going to give rise to excess bone resorption. There are certain associations. It is associated with multiple endocrine neoplasia type 1 and type 2A. So it is associated in men 1 and 2A types, right? Now, therefore, as a result, see what happens is that excess bone resorption occurs. So see here in this particular image, firstly, in this radiograph, see that the cortex is extremely thin, the bone density is decreased, the bone is appearing excessively black or loosened. So what is this called? There is a decreased density of the bone. So this is called osteopenia, right? Osteopenia. Then look at this. This is the radial aspect, right? That is the towards the thumb. So look at all these bones. If you look at the cortex, especially towards the radial aspect, can you see this cortex? Right? If I zoom it up, see, look at these cortices. Can you see that there is resorption? Right? Resorption of the cortices, especially along the radial aspect. This is given a name. This is called subperiosteal resorption. More towards the radial aspect for reasons that are not entirely known. It is more towards the radial aspect or thumb. This is a clincher of hyperparathyroidism. So we know that in hyperparathyroidism there is going to be excess bone resorption when this happens in the subperiosteal location along the radial aspects of the short bones of the hands and feet. This is called subperiosteal resorption along the radial aspect, which is a clincher of hyperparathyroidism. There are various other, clincher appearances that have also been described in the skull. Now, if you look at the skull, there's no focal lytic lesion, but some areas are appearing white, some areas are appearing black. This white and black appearance is called as the salt and pepper skull. This is also sometimes called as the pepper pot skull, salt and pepper skull or pepper pot skull, right? Then there is a striped appearance which is created along the spine where you see that there is a white band, there is a black band, there is a white band, black band. So again, white band, black band. So all these alternate striped appearance is given a name. This is called as a rugger jersey spine, and that is because, right, it resembles a football jersey. Right, so that is how a rugger jersey is, football jersey. So this striped appearance in hyperparathyroidism, this is what is called as the rugger jersey spine. Yes. Now, in the extremities that we've discussed that there is subperiosteal resorption, occasionally, right, the bone may get completely resorbed. It appears round like a tumor, that is given a name in hyperparathyroidism, that is also called as the brown tumor. It is actually a misnomer. It is not a tumor. It looks like a tumor, but it is not a tumor. Remember, so that is a misnomer, but it is actually brown on gross histopathological examination. It looks brown because it is rich with those mineral laden osteoclasts which have resorbed all the bone at that side. So this well defined lucent lytic lesions can be seen inside the bone sometimes in hyperparathyroidism. That is called as brown tumors. Now see, osteochondritis is focal infarction involving bones, right? Focal reactive infarction or reactive damage involving specific sites in the body, and these specific sites are given specific names. So if we see that a lunate bone is involved, so proximal row of carpals includes what? Scaphoid, lunate. So proximal row of carpals, just alongside the scaphoid you see a sclerotic lunate, right, that you can see there. You see on MRI it appears hypointense. Bone marrow is usually hyperintense because of the fat that it contains, right? But when it loses it, right, it gets infarcted, right, it appears hypointense like this. When the lunate is involved, this osteochondritis is given a name. It is called Kienbock's disease. So Kienbock's disease is what? It is osteochondritis involving the lunate. Now, if this involves the tibial tuberosity, now can you see an irregularity involving the tibial tuberosity there, right, where the patellar tendon is attached? It is called as Osgood-Schlatter disease. It's called Osgood-Schlatter disease. Okay, so these are specific osteochondritis. Now see here, in hemolytic anemia, as we have discussed, this appearance when we started with, there is widening of diploic spaces. Why? Because the marrow is trying to compensate for the hemolysis. So there is expansion of diploic spaces, and there are these multiple spurs, so the trabeculae become thickened. This is called as the hair on end appearance or crew cut appearance. Hair on end appearance or crew cut appearance. It is mainly seen in hemolytic anemias, remember. So among other conditions, it is also seen in hereditary spherocytosis, iron deficiency, neuroblastoma metastasis, but in this case it will be more focal and not so much diffuse because it will be seen only at the site of metastatic deposits, not in a diffuse manner. G6PD deficiency, sickle cell, thalassemia major. So it will be seen in hemolytic conditions, mainly crew cut appearance or hair on end appearance. Now you must know that there are the various classical appearances of the vertebrae or the spine that have been described. So typical appearance of the vertebra called H-shaped vertebra like this is a feature of, remember, sickle cell disease. Because of the infarction of the central part of the end plate, the central part of the end plate gets depressed. The peripheral part of the end plate is normal. This gives rise to the H-shaped vertebra of sickle cell disease. A wedge-shaped vertebra, so a partial wedge collapse of a vertebra, or when the bone is weak, when the bone is softened, what happens? The disc itself creates a impression on the vertebral body. This is called as a codfish vertebra or a fish mouth vertebra or hourglass vertebra. As you've guessed it, right, it happens when the bone density is significantly decreased, as happens in elderly postmenopausal women. So these are features of what? These are features of osteoporosis. So these are features of osteoporosis. So wedging of the vertebra, codfish vertebra, fish mouth vertebra, they are all features of osteoporosis. Then vertebra may show certain beaking. Remember, beaking is usually a feature of mucopolysaccharidosis. Mucopolysaccharidosis. Now, if the beaking is in the middle of the vertebral body like this, then it is usually seen in Morquio syndrome. Whereas if the beaking is inferior at the inferior margin, close to the inferior end plate, it is seen in Hurler syndrome. Now here what you see in the radiograph there is basically that one particular vertebra is appearing excessively white. So this is called as ivory vertebra. So the entire vertebra becomes white. It is called ivory vertebra. Sometimes only the margins of the vertebra become white or dense. So like this. So it looks like a picture frame. So this is called as a picture frame vertebra. So ivory vertebra or picture frame vertebra, these are both features of Paget's disease. These are both features of Paget's disease. Okay, so these are few classical appearances. Now we have seen what is rugger jersey spine, alternate white and black striped appearance, right? Resembles a football jersey. We have seen this. High rugger jersey spine is seen in what? It is seen in hyperparathyroidism, right? Sandwich vertebra is a very similar appearance which is seen in osteopetrosis. Remember, sandwich vertebra is a feature of osteopetrosis, and ivory vertebra we have just seen, it is a feature of Paget's disease, right? So rugger jersey spine, hyperparathyroidism, sandwich vertebra is osteopetrosis. Certain classical shapes of the vertebral body is called bullet shaped vertebra. If you look at this shape here, right, it has a narrow nose like that of a bullet, like this. So this is what is called as a bullet shaped vertebra. So this bullet shaped vertebra is actually a feature of a skeletal dysplasia, that is achondroplasia. We will discuss few other features of achondroplasia as well as we go ahead. And when you see a vertebra has become extremely flat, this is called as a coin on edge vertebra or a silver dollar vertebra, right? This is called vertebra plana, right? So this is called vertebra plana. In childhood, if you see, in children, if you see vertebra plana, it is usually eosinophilic granuloma, remember. But if in adults, elderly, you see vertebra plana, it is usually multiple myeloma. So vertebra plana or a silver dollar vertebra or a coin on an edge vertebra, if you see it in children, the underlying cause is mainly eosinophilic granuloma. If you see in adults or in elderly, it is mainly multiple myeloma. Okay, so these are the various classical vertebral appearances. Now another typical condition that occurs in children, especially around adolescent, or say especially around 10 obese children in 10 to 14 years of age or 10 to 15 years of age, right? This is nothing but a type 1 Salter-Harris injury. What happens? There is a fascial plate at the region of the proximal femur, and the femoral head epiphysis actually slips over that fascial plate. So what happens basically is that we draw a line. That line is called as Klein's line. As you can see here, this line is drawn along the upper edge of the femoral neck. Normally it should always intersect the femoral head. Can you see this highlighted red area there? It should always intersect a part of the femoral head epiphysis. But if the femoral head epiphysis gets slipped like this, then this line, which is called as the Klein's line, does not intersect a part of the femoral head epiphysis. This is what is called as a positive Trethovan's sign. So what have we discussed here? We have discussed one, what is Klein's line. So Klein's line is drawn along the superior edge of the femoral neck. It should always cut through a part of the femoral head epiphysis. But if the femoral head epiphysis has slipped, in slipped capital femoral epiphysis, it will not cut through it. That is called as Trethovan's sign. So that is called as Trethovan's sign. So usually, an X-ray of the AP view of the hip and a frog leg view X-ray is done. So in this radiograph, see, let us draw the Klein's line. If we draw the Klein's line on the right, see, it cuts through a part of the femoral capital epiphysis on the right side. But look at the left side. On the left side, if I draw a Klein's line, is it cutting through any part of the femoral capital epiphysis here? No, it is not, because this capital epiphysis has slipped down. So this is called slipped capital femoral epiphysis, right? And this is usually seen in children. We have seen what is Klein's line. We have seen what is Trethovan's sign. Yes, Klein's line and Trethovan's sign. Now, excess growth hormone secretion in adults will give rise to acromegaly. Now, this again also presents with a lot of imaging features. Now, it can affect the soft tissue. So soft tissue thickening occurs on the body. This is prominently seen at the heel pad. So this soft tissue of the heel pad just below the calcaneum gets thickened. So a heel pad thickness, so a heel pad soft tissue thickness of more than 20 mm is considered to be a diagnostic feature of acromegaly. Now what happens again in acromegaly is that growth hormone is being secreted from where? From the pituitary. So there is an adenoma within the pituitary. So if you see, the pituitary is located within the sella. See how large the sella has become. So enlarged sella, as you can see here, right? Then the paranasal sinuses are enlarged, right? So this is what is called as the paranasal sinuses are enlarged. This is what is called as hyperpneumatization of the paranasal sinuses. The jaw protrudes ahead. This is called prognathism. Prognathism, right? The angle, the mandibular angle becomes more and more obtuse, as you can see here. So all these are features of acromegaly involving the skull and the mandible. Now heel pad thickness, increased heel pad thickness, soft tissue thickness is also there. Now the phalanx, right, takes a very peculiar shape, though I could not find a specific image for you, right? The phalanx, the terminal phalanx takes a very peculiar shape like this. This is called as a spade shaped phalanx. Spade shaped phalanx, terminal phalanx of the hand. So spade shaped phalanx, this is also a feature of acromegaly. So various features of acromegaly. Now let us look at certain specific skeletal dysplasias. Usually they don't present clinically, right, with specific signs, but imaging findings are very, very classical. So they can be asked as named signs and appearances in your exam. So achondroplasia. So achondroplasia is basically, if you have seen dwarfs. So this is the most common cause of congenital dwarfism, right? So because it is associated with short bones. So firstly, normally the hand, has two axes. One is that of the thumb, rest of the other fingers. But sometimes in acromegaly, there are three axes because there is another, axis which is created in middle, which consists of the index and the middle finger. And the third axis is found by the ring finger and the small finger. So this is like a three, forked appearance. So this is given a name. This is what is called as a trident hand. So this is one axis. This is the second axis and this is the third axis. So this is like a trishul. This is called as a trident hand. Another specific appearance in achondroplasia, it usually happens at the level of the metaphysis, is what is called as the chevron sign. So what is the chevron sign? Basically is that there is a V-shaped distal end at the metaphysis. So if you look at the metaphysis here, you will find that there is a V-shaped appearance, and the epiphysis actually takes the corresponding shape. This is what is called as the chevron sign. Typical shape of the vertebral body, you see there is a posterior scalloping of the vertebral body and a nose like narrowing like this. So this is what is called as a bullet shaped vertebra plus scalloping of the posterior margin. If you see, the posterior margins have become slightly concave. So posterior vertebral scalloping along with bullet shaped vertebra. This is also a feature of achondroplasia. Another feature of achondroplasia is the lumbar canal stenosis. So what happens is, if you look at the pedicles, right, as we come down, the distance between the pedicles gradually decreases. So the spinal canal actually becomes narrower and narrower and narrower. Just look at the width. So the spinal canal, as you come down from the lumbosacral region, becomes narrower and narrower. So there is decreased interpeduncular distance or lumbar canal stenosis, which also happens in achondroplasia. The pelvis is also involved. So this gives rise to a typical champagne glass appearance of the pelvis like this. So like a glass like this, this is called as a champagne glass appearance. The iliac blades are very broad, wide. They look like the ears of a Mickey Mouse. So this is called as the Mickey Mouse iliac blades. Mickey Mouse iliac blades. Okay, champagne glass pelvis, Mickey Mouse iliac blades. So these are features of achondroplasia. Now, what are these Wormian bones? Right, Wormian bones are nothing but intrasutural bones. That is, when there are cranial sutures, usually inside these cranial sutures, accessory or extra bones are not found. When they are found, these are called Wormian bones. Most commonly, these Wormian bones, they are found in the lambdoid sutures. Remember, lambdoid sutures. Now you can remember the causes of Wormian bones by an acronym called as pork chops. So what are pork chops? Let us have a look. So pycnodysostoses. Pycnodysostoses is a cause of Wormian bones. Osteogenesis imperfecta, right? It is a disorder in the formation of collagen type 1. So grossly abnormal bones, formation wise, structurally, that is osteogenesis imperfecta. Rickets is a cause of Vermian bones. Kinky hair syndrome. Kinky hair syndrome is a cause of Vermian bones. Cleidocranial dysplasia, that is affecting the clavicle as well as the skull vault. Hypothyroidism, hypophosphatasia. So certain other miscellaneous causes, this usually include otopalatodigital syndrome, otopalatodigital syndrome, progeria, syndromes such as Down's syndrome. Right, so these are most important causes of Vermian bones or accessory bones within the sutures. Now, as we've discussed here, osteogenesis imperfecta, I just told you that there is a quantitative as well as a qualitative defect in the formation of collagen type 1. So bones are grossly abnormal. So as you can see here, the bone density is decreased, thin gracile bones, multiple deformities. Can you see this deformity involving the bone there? So if you see here, see the bone is bent like this. So this is given a name. This is called as the Shepherd crook deformity. Shepherd crook deformity, like this stick that a shepherd usually carries. So this is called as a Shepherd crook deformity. Now, one of the features of osteogenesis imperfecta is that because bones are short and bones are weak, the fractures within the bones can be detected antenatally. So antenatal fracture detection is a very classical feature of osteogenesis imperfecta. There are Vermian bones which are also seen. Bones are grossly deformed, remember, in osteogenesis imperfecta. Now sometimes there is a flowing hyperostosis. A flowing hyperostosis along the vertebral margins anteriorly is called DISH, diffuse idiopathic skeletal hyperostosis. But when such flowing hyperostosis, as you can see here, is seen along one side of a limb, see, along the bones, can you see this dense reaction which is happening? So this is what is called as malorosteosis, and this flowing hyperostosis is given a name. This is what is called as the flowing candle wax, molten candle wax, or dripping candle wax kind of an appearance of malorosteosis. Osteopetrosis is characterized by diffuse osteosclerosis or increased density of the bone. Increased density, diffusely increased density. See how white the bone is appearing there. So osteopetrosis is associated with the increased density of the bone. It is also therefore called as chalk bone disease or marble bone disease, though the bones are also fragile. In the spine, they give rise to alternate light and dark appearance. We have discussed this when we discussed with Rugger jersey. Rugger jersey is caused by hyperparathyroidism. This sandwich-like appearance is a feature of osteopetrosis. Another feature of osteopetrosis is that you see a bone which is a shape like this, and inside it you see another bone-like structure. So there is a bone inside it which there is another bone. So this is called as a bone within a bone appearance or endobone appearance, which is also a feature of osteopetrosis. Now, another typical finding which is seen skeletally, which is very prominent, is called acroosteolysis. Acro means extremity. Osteolysis means destruction of bone. So see here, if you see the distal phalanx, can you see how classically the distal phalanx is actually destroyed? Almost all the digits. Acro means periphery, bone is destroyed, osteolysis. So this is called acroosteolysis, resorption of the distal phalanx of hands. Right, again various conditions give rise to acroosteolysis. Let us quickly have a look at them. Maybe they could ask you all of the following are causes of acroosteolysis except, right? So you can remember it. See, the extremity of that limb is pinched off, right? So the extremity tip is pinched off. So remember it by a mnemonic called as pinch of extremity. So what is pinch of extremity? So pycnodysostoses can cause it. Certain infections like leprosy. So certain infections like leprosy also, we know there is bone destruction which is going to occur, right? Injuries like frostbite. So injuries like frostbite can occur, electrical injuries can occur, infections like leprosy can occur, neuropathic joints, neuropathic conditions. We have already discussed neuropathic arthropathy, if you remember, in diabetes mellitus, spinal cord syrinx, or subacute combined degeneration, right? So tabes dorsalis neuropathic involvement can occur. Cleidocranial dysplasia, hyperparathyroidism, hyperthyroidism, because the bone is going to get resorbed. Excess bone resorption may give rise to acrosteolysis, hyperparathyroidism. Other conditions, like a few other conditions like sarcoidosis or kaposis or psoriasis, Kaposi sarcoma can give rise to acrosteolysis. Others, so this is familial disorder sometimes. So these are other conditions. Certain familial disorders and ergot poisoning. So E stands for ergot poisoning. So these are few causes that can give rise to acrosteolysis. So see, we started with this quiz question. We discussed that this is the hair on end appearance or crew cut appearance. We also discussed it is seen in hemolytic conditions, right? Because the marrow is getting expanded, bone marrow is getting expanded, trabecular appearing prominent. So thalassemia, sickle cell, spherocytosis, all are hemolytic conditions. What is not is aplastic anemia. So this appearance will not be seen in aplastic anemia. That is the correct answer to this particular question. Then we discussed this radiograph. We saw that there is Wimberger epiphysis. There is a white line of Frankel, right? There is a Trummerfield zone of rarefaction. Sharp spurs are seen along the metaphysis. These are Pelton spurs. All these are features of scurvy. So of the various findings of scurvy that we have discussed, the only irreversible finding is this white line of Frankel. When scurvy is treated, all the other findings will regress, they will go away. One finding will not go away, and that is this white line of Frankel, which even if the bone keeps on growing in length, that will be seen persistently for many years as a growth arrest line. So white line of Frankel is the only irreversible finding which is seen in scurvy.